anyone can participate in research. It's not scary. It's actually really a cool and exciting thing to do.
It's a wonderful journey. It is not one that is for the weak at heart.
As I started being a researcher, I have learned from every single experience I've had. Each time I work in a team, there's somebody on that team that teaches me something that makes me a better researcher, makes my research better, and provides more help and answers to the questions that I want to ask.
To a certain extent, I suppose, family physicians have a little bit of a researcher in them. All family physicians do. Clinical practices are our laboratory. This is where we do most of our research.
Même encore, ça fait une quarantaine d'années maintenant là, que je suis dans tout ça. Quand je dis que je suis médecin de famille et que je fais de la recherche en médecine de famille, les gens sont surpris, viennent les yeux ronds, ils ne comprennent pas qu'on peut faire de la recherche en médecine de famille, puis ils ne comprennent pas comment on peut vraiment contribuer de façon unique.
We need research evidence to support good practice and primary care policymaking.
With every patient that walks in, there's a question attached to them. I wonder if this would be better, or I wonder if this could be why they've got this particular condition. And it's in that state of wonder that the first step of primary care research happens. So every clinician that sits in a room with patients and wonders is a researcher.
Répondre à ces questions interpelle le chercheur qui vit dans chaque médecin de famille.
As a primary care doc, we're always asking questions about how we can do things differently. And if we are linked up with people who can help answer those questions, I think it gives us lots of opportunities to improve family medicine as a whole.
What we also find is when we find evidence to help us, it's really empowering as a primary care clinician to be able to share that with our patients and say, here's the evidence that we have, what do you want to do next?
Family physicians are committed to providing the best possible care to the patients and the communities they serve. Meeting this commitment requires family physicians and the teams they work with to embrace curiosity and humility in their professional lives.
Au-delà de l'aspect physiologique ou physique du problème de santé, il faut que je comprenne bien qui est cette personne, qu'est-ce qui est important pour elle, dans quel type de contexte elle évolue, qu'est-ce que la famille aussi pense de la situation. Donc, il faut être très curieux, tout le temps curieux. Et être curieux, c'est poser beaucoup de questions, comme un chercheur.
The family doctor must continually ask, how effective is what we're doing? And what can we do better? And how can we address the inequities we see in the healthcare system?
Family medicine is special in that it speaks to the whole healthcare system, and it can guide us for better healthcare policy, both provincially and nationally.
Il existe plusieurs formes d'activités de recherche. Vous serez peut-être surpris d'apprendre que tous les médecins de famille et les résidents en médecine de famille en font d'une façon ou d'une autre.
I'm one of the resident research coordinators, and working with residents, I always see that they have excellent questions about how and why we do things. And by encouraging them to ask questions, they've been able to develop small research questions and research projects that answer those questions and have made meaningful change in their communities.
To understand family medicine research, we can take a look at it from a broad perspective. Research is more than clinical trials and systematic reviews. Primary care researchers lead and participate in these initiatives, and they are very important in enhancing care, improving health services, medical education, and in strengthening our discipline. But they're not the only types of research that family physicians do.
The various roles that family physicians can play in research can be described as an ecology. It starts with those of us who just read research to make sure that we're providing our patients with the best possible care. Then we could get involved in a group that actually takes that research and develops guidelines. The next step might be involved in a group that does research, such as a practice-based research network. Some people then go on to get further training so that they can lead research as part of their practice, using their practice and their patients to answer questions that are relevant to family medicine research. And then there are those few people who actually pivot their practices and their work to spending most of their time actually doing research and much less time in the clinic seeing patients.
La formation de résidence en médecine de famille enseigne aux médecins à chercher et évaluer les plus récents travaux de recherche de grande qualité et à les appliquer dans la pratique clinique.
Also within the spectrum of primary care research, family doctors are involved in the process of developing clinical practice guidelines. They evaluate studies in literature to ensure that clinical practice is based on the best evidence and that clinical practice guidelines represent the perspectives of family physicians and their patients.
Every discipline needs to have its own research to make sure that the research that's done is relevant to that environment. So, for example, if we look at headaches, which are very common in primary care and family medicine, but relatively less common in specialty environments, and only the very tip of the iceberg, those patients with severe intractable headaches get referred to specialist neurologists or headache clinics who then have done research as to what works on those patients to help them with their headaches. But those aren't the everyday headaches that we see in our practice. So we need to do research within family medicine to determine what works well to help our patients in treating their headaches.
We work so closely with community on a personal level, and we really do get to know our patients and the communities that we serve. And I think this allows us to bring an understanding of specific community needs in shaping research that will change policy and be involved in moving forward the healthcare system from a perspective of patients and what patients really want.
And so we began to ask questions, and then we began to recognize there's so much evidence out there that is overwhelming for clinicians. So how can we synthesize that in a way that's usable for your busy clinician? And so we began to develop synthesized tools, like tools for practice, of evidence to help clinicians. So I got involved with some other colleagues who are doing randomized controlled trials in primary care. And so we sort of see this gradual evolution from starting from a simple question to now being involved in evidence synthesis and guideline development and randomized controlled trials, asking questions that we think will really inform primary care practice.
Moving along the range of family practice research, next comes practicing in practice-based research networks, or PBRNs. PBRNs connect family physicians and primary care practices electronically and as a community of caregivers. PBRNs may include a dozen or even hundreds of individuals in a single network. These networks provide opportunities to engage in large-scale, practice-changing research without putting an enormous strain on individual practices. Every practice contributes based on their ability and available resources.
Plus d'une douzaine de RRBP ont été établis au Canada et la plupart sont affiliés à des départements universitaires de médecine de famille qui fournissent habituellement un soutien de base et leur expertise. Les cabinets qui appartiennent à un RRBP aident le réseau en recrutant des patients pour des études cliniques ou en lui donnant accès aux données de leurs dossiers médicaux électroniques, tout cela de manière éthique et en protégeant les renseignements personnels des patients.
I've joined a practice-based research network, and this has given me lots of opportunities. One, to ask my own questions around my data by getting data back on my practice, but also contribute to larger studies. And it's my way of being able to contribute to research as a busy clinician.
PBRNs can supply rapid data to you for your practice if you wish to have this done. There are 12 of us across Canada, and we're all part of the Canadian Primary Care Sentinel Surveillance Network, or CFPC.
The other thing that in more recent years that's really been a boom to family medicine research is the electronic medical records and the ability to combine information from practices in a practice-based research network into one large database and to do searches and to identify potential research subjects.
The wide range of primary care research includes family doctors and primary care teams that lead their own large-scale research projects. These include population-level analyses, clinical trials, and studies on important issues such as mental health, infectious disease, chronic conditions, palliative care, opioid use, and the many healthcare needs that family doctors see in their offices every day.
One of the more fun research projects that I was involved in was a project working with the peer team looking at what is the evidence for televised medical talk shows. And this came out of a group of us just sitting around discussing and out of questions that our patients had asked us around what is the evidence for these recommendations that are made on these talk shows. And it began with me just recording the shows on my PVR in my living room. And eventually I couldn't get the shows off my PVR, so I had to carry the PVR into the office regularly so we could sit and watch these shows. And what I love about that project is it was just a little idea that arose out of a conversation. And when we finally got it published, it just received international attention.
Les premières recherches que j'ai effectuées ont dressé un portrait assez dramatique de la population de soins de première ligne avec une prévalence très, très élevée de patients souffrant de maladies chroniques multiples, ce qu'on appelle la multimorbidité. Et ce qu'il y a d'intéressant dans ces recherches-là, c'est que ça l'a créé, dans le fond, un intérêt international et ça l'a fait qu'après plusieurs années, on a maintenant ces mots-là et ces préoccupations-là sont entrés dans le langage des décideurs.
The thing about primary care research and family medicine research is you're often told as a researcher you need to focus. You need to have a particular thing that you're interested in and that you work on and that you become known for. And one of the problems with that and primary care is we're generalists. So I was interested in everything. And so sometimes someone would look at me if I was applying for a grant and would think, my gosh, he doesn't focus. He's all over the place. But in fact, there is a focus. The focus is that everything I do is through a family medicine lens, through a primary care lens.
Mentors through my university network, as well as colleagues in my area, they really help to shine a light on the importance of making sure that your study is looking at what you would like to get as an outcome, and you're asking the correct questions, that you're going through the correct processes, such as how do you go through a research ethics application? What are the steps to go through in applying for different grant funding so you can do this type of research?
Maintenant, on est des leaders, j'en suis convaincue, de savoir comment on intègre le citoyen, la citoyenne, le patient, la patiente dans la méthode de recherche, comment on pose des questions, comment on va chercher les réponses. Donc, c'est ce que nous appelons maintenant la stratégie de recherche axée sur le patient et la patiente.
Each individual brings expertise to the table. And in co-creating a research project, the community members are involved in all aspects of the project, in the developing of the research question, right through to the actual knowledge translation of the results into something that's meaningful in the community.
We use the electronic medical record data to map out things such as hypertension, COPD, and other disease processes. We use this with data from our public health that looked at things like socioeconomic status, and data from our municipal government that looked at things such as recreational programs, walkability. With this data, we were able to advocate for changes in our community and hopefully improve the overall health of our community.
So some of the research that I've been involved with as a medical student and now as a resident has been around Indigenous health education, particularly on how we educate residents and medical students around the social determinants of Indigenous health. So specifically, what are the social factors, being where you're living or your employment, your environment, and how all of that impacts your overall health and well-being.
We can lead some of the most impactful trials in medicine in our offices with little or no impact on workflow. 360 family docs have already recruited close to 3,000 patients for the BedMed blood pressure medication timing trial. We need to lead studies like that for our patients' sake, because our questions differ from those of our colleagues, and for our sake, because family medicine needs to provide some of the evidence on what best care actually is.
Nous espérons que ces témoignages ont su non seulement illustrer l'excellent travail diversifié qui est accompli dans le domaine des soins primaires, mais aussi vous inciter à explorer les possibilités de recherche dans votre pratique.
You can also join research teams. Every university with a medical school has people like me who are conducting research, and we can only do it better if we have your voices telling us what questions are most important, whom we should be speaking with, and how we should be interpreting our findings.
Research for primary care by primary care. It's not pie in the sky. We're doing it now.